gastric bypass. In gastric bypass, we have two components of the procedure. One is the restriction of the total quantity of the food they eat, and also bypassing the first 1.5 meters of the small intestine. By bypassing the first 1.5 meters of the small intestine, we are inducing the body to secrete more amount of hormones, which cause more amount of insulin secretion and reduce the amount of insulin resistance. So this is very helpful for patients who are more obese, those who need to lose more than 50 kgs body weight, or those who have bad metabolic syndrome like bad diabetes needing lot of insulin, or bad cholesterol, or very bad blood pressure which is needing lot of medicines. In gastric bypass, apart from the restriction of the total calories, as we bypass the first 1.5 meters of the intestine, the body gets the sensation that it is deprived of food because the food doesn't go into the first 1.5 meters of the intestine. So this causes the body to release hormones which cause more improvement in the insulin secretion. That is how almost 80 to 90% of the patients who are diabetics and needing lot of medicines to control their sugars have a decrease in the need for their medication for their sugar, or totally go off their medicines required to control their sugar. Similarly, it comes to that hypertension, but as hypertension is multifactorial, part of the medicines which are required for the hypertension go. So almost 70 to 80% of the medicines which are required for the hypertension goes. Cholesterol levels improve, and this not only, it also improves their general physical well-being, because a morbidly obese patient who is more than 50 BMI has other problems like OSA, means their lungs are getting damaged or their joints are getting damaged. So with a significant weight loss, their lungs can be protected, their joints can be protected. So for a super obese patient who has a bad metabolic syndrome and who has got other organ failures, a bypass gives better results than a restrictive procedure.